Singapore's alert level for the novel coronavirus has been raised to the second highest level. The Disaster Outbreak Response Systems condition, otherwise known as DORSCON, was changed from yellow to orange. That's after 3 new cases with no links to previous cases or recent travel history to China were confirmed today. The total number of cases now stands at 33. The DORSCON level at orange means that the disease spreads easily among people but is contained and not widespread. The impact to public health ranges from moderate to high, and additional precautions will be implemented across the board. Cheryl Goh tells us more.
With the DORSCON level at orange, organizers are advised to cancel or defer large-scale events. If they still proceed, they must take all the necessary precautions, such as temperature screening, and provide sufficient facilities for hand washing.
I understand that Singaporeans are anxious, concerned, and there is much that we do not yet know about the virus. New information is emerging daily. We expect that this is likely to take time to resolve, maybe months. Life cannot come to a standstill, but we should take all the necessary precautions and carry on with life. We will do our best to contain the situation and keep Singaporeans safe.
At workplaces, all employees should carry out temperature checks twice daily, while alternative arrangements such as telecommuting and workforce segregation should be put in place to ensure businesses can continue to run as normal. Hospitals will implement temperature screenings as well as tighten entry controls. Pneumonia patients will also be cared for separately from other patients to reduce the risk of transmission. Preschools and elder care facilities will also limit the number of visitors to their premises. Schools will also suspend all inter-school and external activities immediately till the end of the March school holidays. Even with these tighter measures, the task force said it is prepared to deal with a possible scenario of wider community spread and may implement even more stringent measures if the situation worsens. That is the first of 2 contingencies.
There is another scenario, because if you look at the situation now, the mortality rate in China is 2%, but outside of Hubei province, the mortality rate for this virus is 0.2%. It is much lower than SARS. And if the mortality rate remains low or even continues to fall further, depending on the evidence and depending on how it evolves, then I think we are dealing with something quite different, and we may well have to consider a different approach. So these are 2 scenarios of how the situation may unfold. It's too early to tell right now what the strategy will be, but I'm just sharing possibilities of how things may unfold in the future.
Authorities have urged the public to really pay attention to personal hygiene, such as washing hands with soap multiple times a day, as these individual efforts are crucial in containing the spread. They've even advised people not to shake hands during this period, but adopt alternative forms of greetings.
The national disease alert level is now up a notch at orange. This happened during the SARS outbreak in 2013 and the 2009 H1N1 global flu pandemic.
Well, the Disease Outbreak Response System condition, otherwise known as DORSCON, is color-coded to describe how severe the outbreak is and what needs to be done. Now, the DORSCON starts at green, and at this stage, the disease is mild and it doesn't spread easily. Temperature screenings may take place at borders, such as airports, and travel advisories will be issued. The public is advised to stay home. If they're ill, observe personal hygiene and stay informed.
Going up 1 level to yellow, the disease is severe and is spreading outside of Singapore. Or it is spreading in Singapore, but is being contained. There is still minimal disruption to daily life, with measures implemented at healthcare facilities.
Singapore's DORSCON is currently at orange. Now, at this level, the disease spreads easily among people, but is contained and is not widespread. Public health impact is moderate to high, and quarantine measures are implemented, and hospitals may restrict visitors and implement temperature screening for them as well. Now, at this point, the public is advised to comply with all control measures.
At the red level, the disease is severe and widespread. There may be a significant number of deaths. The public should avoid all crowded areas. Schools may be closed and workers may be asked to work from home.
At DORSCON Orange, where Singapore is at now, the government has ramped up measures for schools and elder care facilities.